That gives us an idea of where the child is at in their kindergarten preparedness. Our home visitors complete those on each of our children that participate in our home visiting programs. And then we get those results that we can share with the parent or caregiver. And then we can share the results with the child's school that will be getting the new kindergartner. And we can also use that aggregate information to see how our children are doing in certain areas. So if we're seeing that social emotional is a greater need this year, then we'll kind of bump up the programming that we do around those areas. We're also getting ready for our Spark Get Ready for School program, which is kind of a kindergarten boot camp. So it's held 2 weeks before the children's first day of kindergarten. They get to go into their future school, spend a couple hours a day for 3 days a week, getting to know the environment, getting to know some of those school norms, such as standing in line, raising their hand. We've gotten really great feedback from teachers that once school starts, those children that went through Get Ready for School are little ambassadors and really can, help the other kiddos on their first day. And we found that it really does help for a smoother transition into school and reduces some stress. And not only the kids, but the parents also. We get a lot of parents that kind of hang out around the school because and they're loud. So it's not only a transition for the kid, but also the parent. We also are getting ready to go back into some of our family events that we have had on hold since the pandemic began. So we are officially planning our Touch a Truck events this week, picking dates for, I believe, 7 of our family developments. So we'll have police and fire bring their trucks and cars, and we're going to find a safe way for everybody to try to get back to as normal as we can. And we'll be inviting all of our partners in our community to share resources and just have a little fun and see some faces that we haven't been able to see for a while. Book Rich Environment, we are still participating in, and we're getting ready to get 7,000 books for the year. That's about it for early childhood. For school age youth, we did recently apply to expand after school programming that is held on site in our Barberton Community Public Housing Center. We're hoping that we can help them get a little bit of extra money to really expand on the great work that they're already doing. The Wi-Fi project there at Barberton is also wrapping up. I can't remember if I've talked about that before, but we really partnered with the city of Barberton, Barberton City Schools, and the Barberton Community Foundation. We all threw in money to get Wi-Fi for our 2 Barberton family developments, and it's almost ready to go. I think that's all I can think of.
Jill, one quick follow-up question. The assessment that you were talking about as the first thing for assessing kindergarten readiness, is that something from the state? Is it from parents as teachers, you all put together?
Summit Education Initiative created it. It's through First Things First. Yeah,
okay.
So it's been found to correlate with our state of Ohio kindergarten readiness assessment.
Okay, great. Thank you.
All right, we'll go over to Anthony Schnumer.
Yeah, thanks, y'all. I'm going to stay off video because I've been in 4 hours of meeting and I'm so very tired of being perceived. I think that'll help me concentrate actually as I deliver this update. But for those of you who don't know me, my name is Anthony Schmucker. I serve as the Senior Program Manager of Health and Wellness Services for the Housing Authority of the City of Austin. I want to share out 3 things that we've been working on in the health space. I think are really cool. One is we've been working on our United Healthcare Community Catalyst Initiative. And the work that we're doing particularly and specifically right now is working on a series of listening sessions or focus groups with residents that are just really big, wide open platforms for residents to discuss what their concerns and priorities are. And it's very much a step in a different direction for us as a health program, focusing on qualitative data instead of quantifiable data. And it's been really exciting for us because it's making us realize, there's no worse way to pretend you understand someone than by putting words in their mouth. And I think that surveys can sometimes do that. And so we've been really excited by, all the gaps that we're seeing in the ways that we think about health from these listening sessions, concerns that aren't on our radar because they're not kind of part of the normal language that we use to talk about health. And so that's been really fantastic, and we're excited by that. And we're exploring what that looks like to incorporate those listening sessions into our work moving forward always. So does Austin Pathways, which is the nonprofit we're a part of, adopt that as opposed to an annual resident survey as a way to engage with residents? And so we've been really heartened by that activity. The next thing that we've been doing that we're excited about is we've been funded by Texas A&M to do vaccine education and outreach. And we've seen a huge decline in the number of cases in Central Texas, at least, which we're thankful for. But what comes with that as well is a large reduction in the number of people who are seeking out vaccines, who are seeking out testing resources. And so we've built out a household level vaccine survey that's allowed us to have some really great conversations with residents at the individual level, going house by house and saying, hey, are y'all vaccinated? And then, having a branching conversation from there that has ultimately led to us being able to say, hey, maybe we didn't convince you to get the vaccine and that's fine, but, are you comfortable with us revisiting this conversation in a month? So creating a baseline for us with residents, which we've been really happy about. And then the third thing that we're really excited about is we have gotten funding from the St. David's Foundation, which is a large philanthropic org here in Central Texas, to move forward on some of our digital health equity work. We've been piloting this program of using community health workers to deliver digital navigation support. So helping deliver devices to kind of overcome the digital divide, but then also be versed in digital navigation skills and vocabulary to help residents learn how to use that computer or device that they've been given. Ultimately, the goal for us is to see them use telehealth services, but that's way far down on one spectrum of use. And we're also concentrating on small things like, hey, if you've been feeling really down throughout the pandemic, does it help that you're able to use Spotify now to listen to your favorite music, right? We think that there are some really small critical activities like that we're able to share that do fall under what we're calling wellness. And so it's something that we're continuing to work out, and we're really excited by that. But that's kind of what we're up to right now here in Austin.
Great, thank you for that update. Alex, I have you up next.
Thanks, Camille. Good afternoon, everyone. I'm Alex Romstead, the Assistant Vice President of Resident Initiatives with the Columbus Metropolitan Housing Authority. We have a lot of exciting updates to share. First and foremost, we're continue to operationalize our HUD and Vision Center. So we received the designation in early 2020, it was January 2020, I believe. And then the pandemic struck, so we weren't able to open our doors. As we're getting closer to entering a new normal and things are starting to reopen in Columbus, we've re-engaged many of our partners to bring in various organizations to co-locate in our Envision Center to provide more direct access for our residents to connect with community-based services. So we're in discussions with having a community health worker staff our Envision Center, which we call the RISE Center. We've recently received a grant to hire a digital navigator through the Columbus Foundation. So we will be seeking an organization to take on that role. Been engaged in conversations with Jewish Family Services in Columbus, who has a grant to provide financial navigation, and they've agreed to put a financial navigator at the RISE Center as well. We continue to have conversations around Community Catalyst locally, and we're developing our intervention strategy and implementation plan, and that's all on track. We were recently awarded a 501c3 designation, which we're so we can start going after more fundraising opportunities. We put out several RFPs for service coordination on the Near East side of Columbus, where we had an investment through the Choice Neighborhoods Initiative, and partnering with CVS Health, who's been an investor in many of our tax credit communities. Received a grant from them for service coordination. Also, I've been working with them to implement a WITC, Workforce Innovation and Talent Center, in one of our communities, where CVS is going to pay to create a mock pharmacy where residents can come to become to get certified pharmacy technician certifications. So very excited about that. Another really big announcement is we were recently awarded a AmeriCorps Vista sponsorship. So we've been awarded 45 Vistas. So we are going to be an intermediary and host site. And as an intermediary, we'll be able to assign Vista to our partners in Franklin County, Ohio. So we're very excited about that. And actually we're able to hire some new staff to assist in that initiative as well. So we're really looking forward to putting those Vista out in the community for the purposes of creating new partnerships to expand services that we offer through the RISE Center. And then we're also gearing up for summer camp right now. So seeking funds for that, engaging partners in conversations. So and then the last thing I'll mention is we're still administering COVID clinics in our communities. So most recently, we're partnering with the Ohio National Guard to bring booster clinics out to several of our communities. So we're definitely staying very busy here in Columbus.
And Alex, is the summer camp hosted by you all, or is it in partnership with someone else?
Yeah, so it's both and. So some of the camps will be at CMHA locations where we're going to bring service providers on site to run camps. And then in other instances, we're actually providing the funding to send our residents to off-site camp opportunities.
Your the CVS and the pharmacy tech, the mock pharmacies, so they train, CVS will train, I think, like residents in pharmacy tech. And is that a degree, like an AA degree, or what, or just what is that?
Yeah, so it's not actually CVS that's going to provide the training. So this WITC initiative, they've rolled out, I think, 10 across the nation. And in each instance, they have a different provider who actually does the educational component. So here locally, we're working with Columbus State Community College, who actually has the curriculum, but it's a certification, as I understand it. We're hoping to start construction on the project this summer and wrap up by the end of the year, but not. The facility will also be used for other educational opportunities as well. So last week, we actually took a bus up to Cleveland to see a WITC that CVS has there. And local schools use it, community colleges, they basically open up the space for a whole host of reasons. But you know, they're trying to create a strong workforce pipeline.
Right.
So we'll have more updates on that, yeah.
Okay. Have you had good sign up of residents, or do you have any data on that?
No, we haven't even started promoting it.
Oh, okay. So it's real early.
So yeah, it's going to be exciting when we were able to actually announce that to our residents.
Sounds great.
Great. And I'm just going to offer Sonia if she has anything to add to that as well.
Thank you. The only thing that I will say is that I'm so happy that I have Alex to to coordinate all of this. So just I can't say it enough appreciative of our team. And as Alex mentioned, it has expanded. And so to be able to adopt our work, we were officially made a resident initiatives department last year, and we hit the ground running, and very excited about being able to receive all of the support. And I think out of all of the positions that we have that are up and coming, one of the ones that I'm most excited about is our strategy specialist position, because that position is the one that does all the time intense things when trying to decide on how we would want to move forward, like evaluating grants and looking at different initiatives to see if they are in alignment with what we are planning as a department, as well as serving as that interdepartment and local department project manager. At any given time, we could be working on over 80 projects at different levels, and managing that is a beast, not to mention we're responsible for the resident services components of our tax credit applications on the development side. and we're getting more involved within permanent supportive housing. So having a strategy specialist on our team to sort of like document that work and make sure everything keeps moving and that we stay on target is new to the entire agency. And it's just really cool for us to have that additional capacity. And ironically, being that we have such a large AmeriVista award, the person that has been assigned, hired to do that is our AmeriVista.
That's very exciting. Great. All right, we have a request from Dan next.
Okay, I'll turn off the glamour shot and give you the real thing here. So, good afternoon, everyone. I'm the Director of Special Programs with the Louisville Metro Housing Authority. We call it special programs. Most places call it resident services. Last Friday, the city of Louisville dropped its mask mandate, and we dropped ours today. So one thing I'm looking forward to, so last summer, when we put the mandate back in place, we were in the process of identifying space at each of our senior developments, and then working with local providers to try to set up a schedule where they could come and set up shop on once a month, twice a month, whatever would work for them to bring some additional services to those individuals. And we kind of had to put that on hold. So we're hoping to get back to that. And also, the city of Louisville has been chosen as one of the newer financial empowerment center sites. And we have built some new offices, one of which would be available for one of those financial coaches to use so when they're serving people in our building. I'm actually sitting in a family investment center site. It's a HUD grant that was only given out 1 year. Most of you probably are too young to even know of its existence, because I think it was 1994 was when it was given out. But it's like a one-stop service center. So it's still up and running after all of those years. So we're hoping to be able to bring one of the financial skills coaches here, at least part-time, and be able to provide that person with confidential space to serve some of our residents. We have done several vaccine clinics at our various sites for initial vaccines and for boosters and for employees, but I think we're probably done doing those because just the interest has dropped off so much. It's gotten to the point where it's more work to put them together, and you have 5 or 6 people show up for it. So I think we're probably done with that. On our digital inclusion efforts, we are approaching the end of the first year of providing free broadband internet at our one remaining traditional public housing site, family site. And so we're going to be doing that for 1 more year. We have an agreement with Spectrum to do that. It's amazing that you can offer internet to people for free and they don't sign up for it. But we have around 500 of the over 600 families at the site who've signed up for it. So, and we're going to try to still get those others to sign up. We received a Spectrum grant, and what we're going to do with that is we're going to install the Wi-Fi infrastructure in the community rooms of our senior sites. The grant will not pay for the Wi-Fi, but we've identified how we can manage that. And that way we can provide some Wi-Fi and connectivity to the residents, but it also will allow us to either take laptops or computers to any of those sites, and we can in a projector, and you can instantly set up a classroom and teach people. And so we hope to be doing that. And also we have at that one family site, we do have a technology center that has been closed due to COVID. So we're going to be looking at reopening that and doing some education there. And then the other thing is we are again participating in BRE, Book Rich Environment this year, and should be getting we got the email, I think yesterday, telling us what books we're going to get. Jill, did you get yours too? Okay. So we'll be doing that again. And hopefully we can go out in the community again to some different things and actually hand those books over to kids. It's so much more fun than just dropping them off somewhere. And that's it.
Great updates. Quick question. Do you have a sense at all of why folks aren't signing up for internet?
I think some it might be they never had it, they're older, they're just not interested. I know of 2 people that had the $20 a month plan from AT&T, which wasn't very fast, but I think they just decided they would rather keep it than in 2 years have to switch back over again.
Okay.
I was on a call with people from Seattle and Baltimore and then Louisville with a representative of one of the FCC commissioners. And so they wanted me to reach out to Spectrum and push them about applying the $30 a month credit to our residents that are eligible towards our broadband bill at Parkway. So I've inquired about that. We'll see what they say.
Okay.
Because that might be something that might make it possible for us to provide that service longer.
Right. Okay. Thanks.
Great. Who wants to go next? Karen, great. Thanks for volunteering.
Knew it was eventual. Hi, everybody. So first off, a lot of our work is done in our client support and empowerment department. I do a lot of the resource development and the strategies and policies. So I can kind of speak generally to all of this because of course I work in a lot of the grants that fund some of this work. But overall, we have been moving to the 2-gen model really thoughtfully and robustly. Not just talking about it, but we are literally kind of taking all of our programs and turning them on their head and shaking them out to see, are they working? What do we need to change? Do they align with this kind of new philosophy? We did develop a website. We're calling it 2gentacoma.org, where we're providing links for families, because a lot of families, still want that kind of information, but they don't know where to go. And we're partnering, of course, with all of our community partners. We're doing farmers markets. We were doing, like a lot of folks, the vaccine and the testing site. Obviously partnering with our health department. We do the mobile food bank, cooking classes, those sort of things. So of course, I think like everybody, we're moving away from a lot of this virtual and outdoor, starting to look how we can bring programming back into spaces safely. The appetite for those type of things with our clients and our residents. We also are working, it's kind of an interesting relationship with the City of Tacoma and Workforce Central. And we're doing this focus group with folks in one of our communities that is focused on healthcare pathways with an attention to living wages, childcare, living wages, childcare, and asset building. And to do this, as we've called on our community as part of this 2-gen model, we're really trying to not just make our programs, and we always had client voice in them, but they weren't client driven. And so we're more thoughtfully stepping back and letting participants tell us what works and doesn't work, like why they don't want to sign up for free internet. Why is that a barrier? Do they even need it? Do they want it? One of the things we're also doing is we signed an MOU with the association at our Hope 6 project to be the facilitator for us, but we're providing through philanthropic funds stipends. We have really come to realize that that's what brings folks to the table to more thoughtfully engage, showing them that we value their time and their lived experience. And so we're also, as part of that, letting the residents design what those stipends need to be and what they look like. Not just us saying, hey, we'll give you $50 if you show up at this meeting. We're asking them, well, what is it worth it to you to participate in this conversation or to help us? Also, when we were thinking about the Wi-Fi, the internet access, we also, again, using philanthropic funds, we're able to convert a lot of our community spaces into these learning spaces, as we called them. We brought in expanded Wi-Fi, we brought in, comfortable seating, we installed more digital boards, those sort of things to make them friendly and inviting. So again, they're not just interesting to either the adults separately or to the youth separately, but to everybody. We've also, along with that, scheduled and been working with our local YMCA called Y on the Fly for mentoring. So we have them there at scheduled hours because, of course, a lot of learning loss has happened, as we know. So asking parents if they want to send their kids, at 3 p.m. on Thursday afternoon down to the community room, there's going to be a mentor there to help them with their homework. And I don't know about you, but all parents, they're game for that, right? Anybody that'll help besides them with homework. So just trying different strategies based on what we're hearing. I know some of you folks were talking about like the on-site clinics. Interestingly enough, we had, as part of our Arlington Drive homeless youth and young adults campus, we have these two buildings, one's an apartment and one's a crisis residential center for homeless youth 12 to 17, and then the apartments are for homeless young adults 18 to 24. And within that building, we had designed a space and we contracted and had an MOU with our community healthcare folks, and they had somebody coming in 2 to 3 days a week, being on site. It's not getting utilized. And again, it's that question of, we've got this on site now, we're making it convenient. Why is that the case? And a lot of the young adults in that building have children. And so a lot of the feedback that we received was that they didn't feel comfortable, even though it was on site, for privacy reasons of their neighbors seeing them going in and asking questions. The services that were there were fairly minimal. They did have a doctor on site, but again, it was only a couple days a week. So we decided we're going to reuse that space. We can use it for office space and meeting space for case management, bring other partners on site that, again, the folks in that building told us they really wanted. Again, these are youth and they're young adults. So while a lot of them have some underlying issues, for the most part, what they really needed was more kind of family support services than an on-site medical clinic. So that was, again, kind of enlightening for us. And then one of the other grants that we received from another philanthropic source is thinking about the senior and disabled properties as we went out to seek a flexible fund. We said some of the things that we might be doing with these funds, but we asked for permission to have flexibility to pivot if we needed. And we were really pleasantly surprised. This donor agreed to that. They started with a $20,000 donation. And the idea was around technology for our senior and disabled folks. And what we realized, again, is just providing the internet or even computers was not really enough for these folks. They need somebody literally sitting right next to them, clicking the button, telling them what they need to do, or them just telling somebody, I need to know this thing. Can you look it up for me? I don't even know how to search the internet. So a completely different approach. We have hired another, which has been really helpful in these types of activities, community builder. We had a community builder for senior and disabled properties, so highly successful, funded by the city, that we have now hired 2 more, and we're having them focus on these income supports for some of our families, not just activities in the community, but focused on things that will help these folks that are interested with things that will improve or increase their income, be it, more services that they need, income support sign up, like, help with food, or things more towards workforce development. So it's been a shift for us, and it makes us have to be patient and pause. You want to throw out a program and say, okay, what do you need? Instead, we have to wait and sit back and let folks tell us what they need. Sometimes just asking them on the spot, they don't know what they need until a crisis or something comes up. So I think patience has been one of the things that we've all learned through this pandemic more than anything, is being a good listener. So that's what I have to report out for the moment. I could tell you so many more things.
Great. Thank you, Karen. I'm really excited to hear about how you've been shifting there, particularly with the resident-driven decision-making. All right, we're going to jump over to Marquise.
Great. Good morning/afternoon to you all. My name is Marcus Gittens, and I'm the Education Youth Development Manager at Seattle Housing Authority. Just a couple of highlights to share. We are currently knee-deep in a digital equity project, really aimed at supporting elders and families with school-age children in acquiring devices and increasing their connectivity. So very similar to what was already mentioned on the call. And our goal is to deliver about 2,500 devices by June 1st. We're also in the process of hiring digital navigators, many of whom will be residents, to support the delivery of those devices, and then also the technical support around using the device, signing up for internet if they haven't already. And then
Marquise, you froze for a second. You froze for a second. Will you just go back a little bit?
Okay, so rewind.
Yes.
Rewind a little bit. So I don't know where I cut off, but essentially our goal is by June 1st to deliver about 2,500 devices. We're hiring 16 digital navigators, many of whom will be residents, and they will support the distribution of those devices. They'll also support providing that technical assistance that is needed. And we're also working to increase connectivity. So many of our residents are signed up for internet programs. However, some are not. So that's one strategy, help them sign up for programs that are already available. And then we're also working within our buildings to create stronger signals and allow more people to be able to access the Wi-Fi that's available in our buildings. We're also engaged in vaccine clinics, like many of you, currently doing booster clinics for both staff and residents, and really the community at large. We're also preparing for summer programming, and typically we host a variety of community partners to provide both educational and enrichment programming across our spectrum of ages. So some of those things will include, cooking and self-defense classes and digital art classes, along with tutoring and mentorship as well. We're also working on deepening our resident leadership and co-design pathways. So we piloted advisory council this past year in one of our communities, and this to launch that across 5 of our communities. And so our Youth Advisory Council is really focused on all issues as it relates to youth, but with a special emphasis on having safe and inclusive communities where youth can thrive. And so based upon what we're hearing from youth, community safety is a huge concern for many of our residents. And then also just being able to like have space in the community. There's like literally some communities, there's no space for them to gather, at least a safe space for them to gather and feel like they belong there. So we'll be partnering with our youth to work on those things and other things. They'll also be providing some evaluation of the programming that happens for youth and helping to provide feedback to our community partners who are providers. We're also deepening our family leadership work and supports. We're currently embarking on a project with Seattle University where we are hiring 16 family fellows to work with math teachers across 6 elementary schools. And this co-design project will be focused on math justice. So families will be focusing on learning techniques to help their scholar at home. They'll also be creating a sort of supportive community where they can help other parents navigate partnership with the school district and also supporting their child at home. But then also building the capacity of school staff and working with our most diverse students who typically have fallen behind as the data indicates. We're also doing a very similar but separate project focused on some racial equity teams in schools where we have a large SHA population. So racial equity teams in the Seattle Public School District are typically focused on a particular theme. And for the schools that we'll be partnering with, that theme is attendance. So they're focusing on how do we make sure across all of our demographics that we're fostering strong connection and engagement with our youth and families in a way that improves attendance. So we'll have family leaders, a part of those committees in somewhat of a pilot program. And finally, I'll just add that we are progressively trying to be a lot more inclusive of residents who may have interest in jumping into like a youth development or education type field. And so we have sort of trainee positions for residents who would like to participate in programming. We piloted this last year. We had young adult resident who piloted a program for middle school youth. And it was like actually too popular and too good. We had way more youth attending those events than what we had space for. And even those residents, there was one resident leader and other residents who were supporting were kind of outdrawing some of the traditional nonprofits who had been in the community for a while, just based upon their responsiveness to and their relationships with youth in the community. So we're continuing to sort of try to create pipelines for residents to participate in a variety of ways. And that's all I have.
Thank you. That was a great update. That's lots of really exciting work. I am going to jump to Andy Chan and stay with the Seattle theme. Andy, do you have anything you want to add from your team? Andy, we can't hear you if you're talking. Andy, we can't hear you if you're talking. Maybe we'll come back to you. I saw you come off mute, but we can't hear you. Come back to me. Okay, sounds good. Who else do we have? Aisha?
Hello, can you hear me?
Yes.
So I'm trying to find my camera. Not that anybody wants to see what I look like today. There we are.
You're looking great.
It's been one of those days. So my name is Aisha Razak Ellis, and I'm with the Goldsboro Housing Authority in Goldsboro, North Carolina. And as I sit here and listen to what everybody else is doing, I'm mostly stealing ideas. So don't go back and tell the powers that be. But I am the director of our Jobs Plus grant. So under that, of course, we really are looking at getting people hired, getting them employment that will sustain them. The issue we're having is that people don't really want to work. So that's been kind of our struggle. But we do also do a lot with early childhood education because our local schools, of course, the majority of our kids attend them. So we offer a kindergarten boot camp as well for our children that are going into kindergarten. We do a 2 to 3 week program to kind of prepare them for school. We are also looking at ways that we can offer some more supportive services within our communities to help with reading literacy. We are kind of starting that initiative, so we haven't done anything to officially kick off. So again, I'm still in other people's ideas and information so I can know, take it back to our powers that be and just kind of plan from there. And then the kind of biggest thing that we've done, of course, is the COVID testing and on-site COVID vaccines, especially the past couple of months with the spike in the Omicron variant. So just being behind that, making sure our residents, those who aren't mobile, that we have someone who could go to the house and do the vaccines and the boosters, and those who wanted them kind of get those. And right now, those are our updates.
Great, thank you. And part of this whole gathering is to steal ideas. So I'm glad you came to listen, and you know, hopefully you can connect with the people on this call. But if you need anybody's emails, let us know, and we can connect you as well.
Sounds great. Thank you so much.
Yeah, that was perfect, because I usually say that at the very beginnings and forgot. So thank you so much. That one of the things we love so much about this is, of course, it's so helpful to us to hear what you all are doing. But what has been great in the past is for you all to connect with each other and get new ideas and ask questions. So I promise I didn't pay Aisha to say that. And I see we have just a quick update from Andy.
Yes, real quick, Albert, before we do that,
Yeah.
I had a question come from the Association of State and Territorial Health Officials about what we're doing in the field. So I'm gonna launch just one more poll. So to get a little bit more information from you all about working with your public health department. So we'll read Andy's note as you all can just fill this out real quickly.
And I'll just say, because I know we are coming up on the end of time here, that encourage all of you to join that CLAFA member call next week so that we can do follow-up with you about the tax preparation information that you indicated in your poll. As I said before, we'll be digging more into that next week. So I know for some of you, it may be other staff from your departments or agencies who might be attending, but if you could look into that and adding it to your schedule, that would be fantastic. So while you're filling that out, whoops, looks like I can't access. Let me close the poll. Sorry, Zoom won't let me access the chat when the poll's open.
Okay, I will take care of it. So Andy said he's having sound problems. SHA is wrapping up the contracting for the latest iteration of our behavioral health program. Community Catalyst is rolling along. Yes, you are. Thanks, Andy. For Marquise, we're still vaccinating 21 booster clinics, averaging 26, a total of 550 boosters given. Still contracting for hoarding and clutter, and then mediation service contract out there too. So also just a plug, we have a Housing is Working Group webinar planned for April. It is April 12th. And originally we were going to be focusing on working with public health departments, but we're actually going to repurpose this and focus on behavioral health issues in our communities. It has come up time and time again across many of the PHAs that I work with that this is a major challenge. Just interested in picking each other's brains on solutions and what people are doing. So please keep that on your calendar. We'll be sending out more updates there on that. But that just again is going to be April 12th, 2 to 3 p.m. Eastern time. Okay. Well, thank you so much. We are just at time. Oh, and let me end this poll and I can share. Thank you for all your responses here. Any last comments or things, questions people want to share?
And I'll just reiterate what Camille was saying, that if any of you don't have contact information for someone who is on here that you want to do follow-up, please just get in touch with us and we're more than happy to facilitate that. Sounds like possibly a future conversation about hoarding would be. I don't know that we typically share the notes kind of more publicly, but we could probably pull something together if that would be useful.
Perhaps for the people who are actually on this call, I'm happy to share out my notes that I've taken for me. Does that sound good? Okay, great. Wonderful. All right, well, thank you everyone. This has been a really great update call. You all have our contact information, so if you want to continue any of these conversations or connections, feel free to reach out. Thank you, everyone. We'll talk to you soon.
Talk to you later.
Thank you.
Bye.